You're watching IKTV and this is Unrendered. My name is Tony Regisford, and on this edition, I'm pleased to introduce to you Dr. Donna Brown. She's here with the World Pediatric Project. She's an ophthalmologist and she does pediatric ophthalmology. Dr. Donna Brown, welcome to St. Vincent and welcome to the studios of IKTV.
Thank you, and thank you for having me. It's a great opportunity.
Now, before I get on and talk about the World Pediatric Project, I want to hear a bit about Dr. Brown and give me some background. How did you get into medicine? How did it all start for you?
Okay, well, I was in a family of 4 daughters, 4 girls. My dad's a minister, my mom's an educator, and they always told us we could do whatever we wanted to do. So one year in college, I was doing some volunteer work in the summer at a camp for girls, a Baptist camp, a Christian camp affiliated with the church we were members of, and my dad was the pastor. And I felt that because I was good in science, I should do something with regards to medical care.
Right.
And then I remembered my mother's voice in my ear saying, you can do whatever you wanted to do. And even though at that time, I think that medicine was still male-dominated, if you will, I thought, I can do this. I can make a difference. And I thought, one thing I can do is to become a physician.
Right.
And all I had to do was say that to my mother, and she was completely all over that.
She wanted that.
She wanted that. She was glad to hear that.
Right.
And she actually helped me quite a bit in just the logistics and the process. So I continued my education in college and then applied to medical school and was fortunate enough to get in. Met my husband in medical school. We married. Trained in Dallas, Texas, where I did my...
So you're a pair of doctors then?
We are a pair of docs. And we both were interested in surgery. We morphed into surgical subspecialties as we went along in our training for a variety of reasons. And he is a urologist and is also here working. And I became an ophthalmologist and then did 2 years of extra training to be able to do 2 subspecialties, pediatrics, and that also includes adult strabismus. Strabismus is misalignment of the eyes, and also cornea and external disease. That has to do with corneal transplants and other diseases of the front part of the eye.
Right. So you've been at this now for a significant period of time, and you're a veteran, eh?
I am. I have been in practice in Richmond, Virginia for 25 years, actually. So we've been at this a while.
And are you from Richmond, Virginia?
I'm not. I'm from actually Tennessee. I was born in Alabama. My dad being a minister, the way things are there, often they were moved from different church to different church. And so although I was born in Alabama, I lived in Tennessee most of my life. Went to school in Tennessee and then Texas. And then we ended up in Richmond and have been there for 25 years and raised our 2 girls there. We have 2 daughters.
You're here in St. Vincent now, and you're here for the World, as part of the World Pediatric program or project. Tell me about this project. What is it? What is the World Pediatric Project?
The World Pediatric Project is really what I consider a linking organization. What we try to do is to provide pediatric critical care to countries that cannot provide it for themselves. We work with Eastern Caribbean countries and Central American countries. Our work is in the Dominican Republic, in Belize, Honduras, Guatemala, Panama, and then St. Vincent and the Grenadines, and the other OECS countries.
So when you say world, you're talking about Latin America, it looks like, and the Caribbean.
Correct.
Basically.
And what our goal is to provide what the countries themselves cannot provide. If there, for example, is not the pediatric subspecialist there or the equipment, diagnostic or surgical, to do the care, we want to provide that. So we have basically several programs. We have what we call a We Send and a We Bring program. We send diagnostic and surgical teams to all these countries, and then we do, for those trips, we evaluate the children, we determine which ones can have surgery there, and we provide the surgical care there at the hospitals in country. The children who have a more complex problem, surgical usually, we then bring those children to the United States, predominantly to Richmond. That's where our organization is based. And all of our hospital systems in Richmond participate with our program, not only the Academic Center, Virginia Commonwealth University, but the other hospital systems. We also bring children to St. Louis. That's another satellite city for us. And depending on the condition, certainly with our orthopedic work, we use the Shriners hospitals. We have found that in the United States there are a lot of pediatric and children's hospitals that have capacity to take our children when we deem that that it's necessary. And all of the care that the physicians and nurses, etc., arrange is all done gratis. There's no charge for the patients once we get them to the U.S., and certainly there's no charge when we're in country.
Right. How did this originate, though? How did the idea come about to do a World Pediatric project?
That's a wonderful story and a great question. And we actually once were called the International Hospital for Children, and you probably remember that name, many of you who have known about us for a lot of years. And it really started with an orthodontist in Richmond who was a member of a Rotary Club, and he did volunteer work in Ghana. And so when he would go there, he would take care of the dental needs of the population, not just kids. But one day he saw a young lady on the side of the road who was very emaciated, undernourished, almost at death's door, and he inquired about what was going on with this child. And the young lady had accidentally ingested lye and had had a significant injury of the esophagus, preventing her from being able to take nourishment at all. And it so broke his heart that when he got back to the United States, he talked to his Rotary Club and raised money to bring her to Richmond. And a procedure was done, her life was saved, and of course now she's an adult and doing well. But through that he thought this is a need in so many countries, because that country would have taken care of that child had they had the means. And he got the idea that, you know, if there are practitioners and facilities that can just link this need, maybe something could change. So he got a few of his friends, he developed a foundation, and one thing led to another, and he developed what was called International Hospital for Children. And his dream was that there would really be a hospital that children could visit. It's become a virtual one, if you will, because it is not really practical. To run a hospital is incredibly expensive, as everyone knows here, and to do that isn't as practical. Plus, not every facet of the hospital is needed, because primary and secondary care are done typically very well in the countries in which we serve, and we provide just that can't be provided in
the
country.
specialty areas,
So it's just grown. We really started only in 2001, so it's a young organization, 14 years in the making, and have already been able to grow our programs, again, because there is a lot of need. We have figured out really how to make it work by linking all of the different facets that have to be in place in order for something like this to work, whether it be the practitioners in country, the ministers of health in country, the local governments, the civic organizations such as the Rotary Club that helps us with some of our work here. There are just a lot of things that go into it. Even something as simple as the Customs Department helping us when we ship supplies here. So there's just a lot of facets, and we have a wonderful CEO who is just brilliant in managing and figuring out how to solve problems. I think the thing that's kept us alive and doing well is our continuity. We come every year. We see our post-ops. This year I saw 3 children who had come to the U.S. to have surgery, not just by me, but some of my partners in my group. A glaucoma patient, etc., a little baby who was born with glaucoma and now is going to not be blind because of this my partner did. And so each year when I come, I check that child to be sure he's still okay. So I think the fact that we come and we don't want to just drop in and drop out, we want these children to be cared for, and we have a wonderful network of pediatricians and in-country physicians who can take care of these children post-operatively when need be, etc.
Well, you said it was the foundation, so clearly you get monies from, well, you know, it takes money to keep this thing going, so you get monies from, I guess, philanthropic people who donate large sums to keep the is that your primary source of
funds? We do have several ways that we raise money, and it's a challenge. You know, it's challenging to do, but most of the time when people hear our story and hear what we do, and the physicians volunteer, et cetera, we usually are successful. But we have several ways. We actually have an auction each year, and it raises a good sum of money. Last year, our auction, and I'll tell you about that because it's pretty special. We raised about $850,000 US.
That's good.
And what that does is it goes to the infrastructure. It takes a lot of staff to prepare for the trips, to arrange the transportation, the supplies. We have 2 in-country reps here, Sister Jackie Brown King and Lucianne, and we have other in-country reps in some of our other countries, lots of staff. And so it's just an expensive endeavor. We do leverage a lot, though, because we have a lot of gift in kind, as you might imagine. So we raise money. And at that auction, the interesting thing about it is we auction vacation homes. For example, if there is a resort here in St. Vincent, they may donate a week.
Right.
And we auction that, and that money goes directly to World Pediatric Project. There's several homeowners in Mystique who have given us their homes. And as you can imagine, that's such a special place, and people in Richmond would love to go.
Happy to go there.
They're going to go on vacation anyway. We say, go to somewhere really nice, and the money that you've spent, we get to use to help the children there.
Right.
And because the families in Mystique know that what we're doing is to help St. Vincent and the region, they're very generous to do that for us. And the other countries in which we work do the same thing for us, and so we can raise a lot of money that way. We also have other fundraisers in Richmond that we do. We do have often we'll go out and solicit people who we know can afford to give to us, and just explain to them what we do and ask if it resonates in their heart. Most philanthropic people have an organization they really find they love, they adopt. We just hope it's going to be ours, and if not ours, another. But
this depends on if it fits what they think they want to contribute to.
Right.
Yes. Now, before we get into the details of what you're doing here, let's speak a bit more about the World Pediatric Project. How big is this organization? How many volunteers do you have? I mean, you talk about a network of people, so. You know, how many people, when you look at it across the areas that you attend to?
That's a good question. And we probably have 20 to 30 employees in Richmond and St. Louis. So
they're full-time employees?
Full-time employees who do the work of arranging the children to come to the U.S. and arranging the teams to then come here. I may be underestimating that slightly, but that's probably accurate.
Around where it is.
We have... I'll take St. Vincent, for example. We send 11 teams here every year. So you've got at least 11 to 12 surgeons that are coming. There's a couple of diagnostic teams that come. Our pediatric cardiologist comes here. And with those teams, typically there are nurses, nurse anesthetists, anesthesiologists. So you have that many at least. And the same number goes to Belize. Belize is another big program that we have. And so we send a similar number of teams there. So lots and lots of docs and surgeons and anesthetists and nurses, and then some full-time employees that do the administrative type work. We have several full-time fundraisers to try to fund the organization's needs.
Right. So it's really a business in its own right, but a business that's not for profit. So
that's true. It's definitely, and I should have said that straight away, because it's a non-for-profit organization and has that status.
Okay, good. Well, we're at the end of our first segment. When we come back, we would take a little look into exactly what the project has been doing over the years it's been operating here in St. Vincent when we come back. This is Unrendered, and my guest is Dr. Donna Brown. You'll meet her again when we come back.